Hi there, welcome to another EMG Talk About. My name is Amanda Vande. I'm VP of Client Services and Business Development here at EMG, and I want to just introduce you guys to Camille Strickland. Camille joined our team earlier this year, and she's our Client Services Director for our healthcare vertical. So just wanted to introduce her to you guys and get some questions answered by Camille. So first, just want to understand your background and how you think that fits in and applies to what we're doing here at EMG.
Well, I think my background, because it's mostly in behavioral sciences and then in healthcare administration from grad school, I love to study behavior and how people react to information and use it to make decisions about their healthcare. So essentially, I see EMG as sort of the expert in that area, and I love being a part of that. It's nice to kind of do what you love. So
very cool. So as an agency, we work with several verticals, of course, as you know. So healthcare is one of them. We also work with higher education, some financial services, insurance, entertainment, lots of other things. So really our goal for the year and how we're really structuring our organization is having these experts such as yourself kind of lead the charge for that vertical expertise internally and managing active clients and working with new clients. So, what do you see? Do you see that as a benefit for our clients? How do you see that vertical expertise really benefiting EMG in general too?
definitely, I see that as a benefit to all of the clients, especially in healthcare, where oftentimes the adoption rate for almost anything innovative, everyone perceives it as very slow.
Yeah.
It's nice to sort of shorten the learning curve on a lot of the innovative strategies that are taking place across marketing, healthcare services and providers. And so I think EMG is doing a very good job of sort of positioning itself to be a leader in that area.
Yeah, definitely. Well, that's the intent, and we're glad you agree. So, I'm interested to know where you see the biggest challenges for healthcare specifically right now when it comes to communication, online marketing, their web presence, just how it all fits together and kind of the bigger challenges you see facing healthcare.
Well, I do think in healthcare, as with most things, perception is reality. And so that challenge, even from a quality standpoint, also presents an opportunity for healthcare providers. You get to essentially tell people who you are before they arrive at your hospital door. And then you have the opportunity to sort of carry on your brand message, create additional messages, even expanding the value that you provide to patients outside of the hospital. All of those things become possible with a very integrated web strategy. And so I think the goal here with EMG and the clients that we work with is to help them to sort of target who their audiences are and how to reach them, knowing that it may not be the same for all of those audiences, but that we can definitely do that at a cost-effective manner.
Yeah. So I think another topic to discuss is the role of the agency in this too. With all of these different channels and essentially having to cover all these areas, internal resources can't likely keep up with that. So do you see that as being?
I do. I mean, in any healthcare organization, marketing budget is always sort of like an ever-present discussion, and sometimes it's important to understand that you don't have to take all of that on by yourself. Sometimes it is nice to have experts that you can rely on to take care of different parts of your campaign. And I think it's really important also to note that no matter who you're partnering with, that person has to have your overall goal in mind.
Absolutely.
And I believe EMG does a really good job of taking into consideration what departments are doing in general. We want to know your business. We want to know how you do business so that we can help you accomplish those goals. And so that's what I look forward to helping our clients to do.
That's great. So, you've been in the healthcare industry, in your education and then on to all the positions that you've held, these strategic positions within the last many years. How have you seen the industry and marketing specifically evolve? What's the biggest area you've seen change in?
I think definitely from a marketing standpoint, we've definitely changed our delivery channels over the years. When I first started out, and even as an intern, I was more concerned about the basics, working with an agency to do ads or booking a billboard and things like that. And I've seen us sort of move into more of the innovative, what can I do that will get me the most bang for my buck? A lot of that is driven by your web strategy, yes, but if you look at traditional media and even how that has changed over the years, billboards have gone digital, and all of a sudden they can tell you how many people are passing by your board at any given time. I think all of that just points to a need as an industry in healthcare, particularly, to stay on the cutting edge, because that's how we provide value essentially for our consumers, our patients, and customers. So,
all right. So, do you have anything else you'd like to add for our viewing audience?
Just like to say thank you for having me, EMG, and to everyone else out there, looking forward to meeting you. Give us a call.
All right. Thank you guys so much. Join us next time for our next Talk About, and we'll talk to you soon.